Today we are talking about the current state of healthcare and how to cut healthcare costs. My guest is Dr. Donna Milavetz. She is a licensed medical doctor and internist with over 20 years of clinical experience. Her area of expertise is developing and running on-site medical clinics and wellness programs. She trained at one of Harvard's teaching hospitals and also holds a master's degree in public health from the University of Minnesota. Dr. Milavetz was on faculty at the Mayo Clinic Rochester prior to moving to Utah, where she then started her company, OnSite Care, in 2006. Donna is super passionate about advancing the quality of community healthcare, specifically in improving healthcare outcomes while driving down wasteful medical spending. In this episode, you're going to learn about the healthcare industry and trends right now and building a strategic healthcare plan. Here is my interview with Dr. Donna Milavetz. Hi, Donna, and welcome to the show.
Thank you for having me today. It's really a pleasure to be here, and I'm excited to get started.
Good. We're really excited to have you. Your company has been on the Fast 50 here in Utah every year. You guys have won a bunch of other awards. But before we get into that, why don't you just tell us a little bit about what your company does?
So we put comprehensive primary care clinics on large employer group campuses. So we spend most of our waking hours at work, so why not get your health care right where you work? We make access really easy. Most of our clinics are no-cost clinics, so really free health care. We align really the doctor with you, the patient, and we just happen to do it at work.
So what do you mean by no-cost clinics? Is that no cost to the employee or no cost to the employer?
So no cost to the employee. So you can walk in once a year, you can walk in every single day if you want. There's no co-pays, there's no deductibles, there's no co-insurance. You just go and you get your healthcare needs met.
Cool. And why do you think employers are willing to do that for their employees? What's the reasoning behind that?
Wow, that's a long question with a long answer. It's actually a short question with a long answer. But health and productivity and kind of corporate wellness all are tied together. And there's more and more research that is emerging that all of these are really tied together. So there's a concept called presenteeism. I call it the lights are on, but nobody's home. So you go to work and you're not feeling well, or you're worried, or you're distracted, and your productivity goes down 50, 70%. But you're showing up for work, right? You're a warm body in your seat, but you're not doing what you need to do. And so to combat that, employers are realizing that they really need to be engaged more in people's health. They don't want to manage their health. They don't want to know about their health from an HR standpoint, but really they want their people to be healthy so that they're productive and they're contributing to growth of that company.
Excellent. So what do you think that healthcare has to do with company culture as a whole? It's kind of like one little segment. And how does that tie into culture overall?
I think that healthcare and culture are really intimately linked. It's the first thing that we ask about when we ask about benefits. Do you offer health insurance? It's a huge cost driver for people. I just saw a recent estimate that out of take-home income, 23% of everyone's take-home income now goes to paying for healthcare.
Wow.
It's only second to the cost of where you live. So it's a huge cost, and so it's on top of mind for lots and lots of people. And for those employers who differentiate themselves in the marketplace by saying, you know what, we want to offer great benefits, we want to make sure that you're healthy, we want to make sure that you're engaged, that really ties into that value proposition of that employer, which then is part of that whole culture. So they're intimately linked. And those employer groups who are really engaged with that idea of health and wellness really are companies that are on the Fortune 100 list, is because they really want to value their employee holistically, not just in segments.
Okay. So do you have any examples you can think of where you've seen a company do healthcare wrong and it's had a negative effect on their culture?
Yes, sadly. So in our society, we have moved to these high deductible healthcare plans, which is a fancy word for saying cost shifting to employees. So as the cost of healthcare continues to rise, a strategy for employers is to say, okay, we're going to now move from a $1,500 deductible to a $5,000 deductible. And that's really scary for employees. And if you don't do anything between that gap of $1,500 to $5,000 to help that employee manage those costs, that employer is going to lose their valued employees because they'll go down the street to another employer or to a competitor that has a smaller gap. So cost shifting without another strategy tied to that, whether or not it's contributing to an HSA or an HRA, with otherwise putting in a workplace clinic, which is our solution to the problem, that's the wrong way to do it. You can't just shift away costs and expect your employees to stay at your organization, because it's taking away benefits rather than enhancing them.
Okay. Do you have any examples of a company that has done healthcare really, really well, and you've seen a direct correlation between a shift in their culture and that improvement of their healthcare that they provide?
Absolutely. So if you want to do the Cadillac version in terms of doing sort of the corporate culture and health and wellness together, the comprehensive package really is total employee and health plan engagement. So having a robust wellness program that applauds and rewards people, not just for checking off boxes, but for really engaging in health, in the total aspect of health. So mindfulness, nutrition, exercise, really, as well as their medical care, really makes a huge difference. Having a workplace clinic, unbiased, and making sure that you have an easy access to low cost or no cost care. Having an on-site pharmacy with a dispensary right there to get your medications. Making sure that you're bringing in employee assistant programs right onto the campus. The more that you can do to drive within the campus of the work site from all sorts of aspects of wellness, on-site dental as another example, the more robust that benefit plan is, and that really leads over, if you will, to corporate culture and to that sense of being valued as an employee.
So have you seen there kind of being a trend that more and more companies are starting to bring all of their services on site?
So there is. If you're a large enough of employer group, and typically, we're talking about 200 people in the same geographic location, you're seeing more and more of those employer groups moving to self-funded solutions as opposed to saying fully insured, and they're bringing in lots of services onto their campus to make sure that, that they have all of their services right there. Mobile mammogram. What a huge benefit for women, for women's advocate, for women's breast health, to be able to get your mammogram right there and not have to leave the workplace and schedule a half day off to go and do something that we don't always necessarily want to do. Yeah. As an example, bringing in corporate massage. I mean, that whole idea of total wellness is really, that holistic approach is really important as companies continue to enhance these sort of more holistic benefits.
Yeah, and I see that really as a trend in the world in general, the way that the U.S. is going. More and more people are starting to want to bring things on site. I mean, there's like Uber came out, and now there's all these like little Uber spinoffs in different industries of like being able to order services direct to your location or order food from your favorite restaurants delivered to your house and things like that. So I wonder if that's a trend we're going to see continuing as time goes on, and seeing more and more, just because I think today we have less time. Wouldn't you agree? Just people...
We're packing more and more in. I mean, this whole idea of immediate access, right? Texting, Twitters, the whole idea of instant access to information makes our lives a whole lot faster. And so I think that's also happening in healthcare. Telemedicine is a perfect example. Being able to do exactly what we're doing, which is Skyping, and being able to access medical care telephonically or, from an audio standpoint, is huge. And that technology didn't even exist 3 years ago. So this idea of how do we leverage our IT infrastructure to bring services to us is I think we will continue to see evolve. Wearable technology, right? Fitbit as an example. There's a new app coming out on your mobile phone that you can actually do a portable electrocardiogram. You can stick your iPhone up to your chest and get a portable reading of an EKG. I can get glucose data transmitted to my electronic medical record from a mobile device. I mean, it's amazing. We're getting smaller and smaller in terms of the world coming to our doorstep, if you will.
Absolutely. That is so interesting. And I completely agree. I've seen the same trends kind of going on in society as a whole and also in the business world. Yeah. So you want to tell us a little bit more, just kind of what you see the current state of healthcare is right now in the U.S. and where you think that's going, what you see trending in the future, more than just the on-site clinics, but healthcare as a whole.
Absolutely. So I look at the world as populations. So there's the Medicare population, which is the 65 and older population. There's the workplace population, which is for all intents and purposes 18 to 64. And then there's the special needs population. And so I'm going to talk specifically about the workplace population because that's the sandbox that I play in. But what the Affordable Care Act did, whether you like it or not, did two things. It created a whole lot more opportunity for people to have health care, and it mandated that we all have health care. As a consequence, both intended or unintended, costs have risen as a result of that, and access to health care has gone down because there's this huge bolus, right? 27 million Americans now have health care that they didn't have 3 years ago. And the pool of providers hasn't really changed. So costs have gone up, access has gone down, and that trend will probably continue unless there are some changes made in legislation, which will be remaining to be seen post, November in the White House. The other thing that we're seeing is that there's new pharmacy options that are coming down the pipeline, right? Hepatitis C, 2 years ago was a non-curable disease. We've got a pill now that cures hepatitis C. It's $87,000, right? So it comes at a high price point. But if you're the one with hepatitis C, you want that pill, right? You want the treatment. So technologies continue to advance, but it's at a much higher price point. We're getting into this whole aspect of personalized healthcare. So using your genetic makeup to decide on is pill A versus pill B better for you because you metabolize drug differently. Looking at genetics in a whole different way. I mean, it's really exciting what's out there from a advancement of healthcare, from research and development. On the flip side, we continue to get more and more sedentary. We continue to get larger and larger, sadly, and chronic disease starts sooner and sooner. And so, if we don't start making some important strides in stemming those determinants of health that really predict future badness, like obesity as an example. Obesity leads to high blood pressure and cardiovascular disease and diabetes that we need to address as a society. Why aren't we embracing weight loss and fitness better? So much easier to buy the $1, fast food meal than it is to go and buy a really organically based meal, right? And until we grapple with that as a society, we're going to continue to have problems, I think.
Definitely.
So that's sort of the scope of kind of where I see healthcare is that I think that the working class age group people is really the population that we need to make big changes in, and big changes soon, because we'll soon become the Medicare population, and then there's not a whole lot more that we can do, right? It's just rearranging deck chairs on the Titanic, right? Cat's out of the bag already on that one. But if we can make big changes now, we can avoid a whole bunch of costly, bad chronic diseases down the line that will dramatically affect in a positive way the bottom line for the cost of healthcare in the future.
So speaking more to that, what is it for businesses and people in HR, people in these leadership roles? What are the things that they can do to help manage those costs as they're rising and help reduce that that liability the company is under?
So I think the first sort of important step is to really have a healthcare strategy for your company. And most companies look at healthcare as kind of that necessary line item rather than as part of their strategic plan as an organization. Every business has a strategic plan for growth for their company, but nobody has, or very limited companies have, a strategic plan for their healthcare. So I think that's the first really big step and the big hurdle to overcome. Like, what are your healthcare goals? Are you a smoke-free campus? Do you subsidize food? Do you have vending machines? I mean, simple things. Do you have access to a walking path that let people go out on breaks to go out and walk? So this idea of embracing health and wellness is really critical, I think, to a longer term strategy. Healthcare renewals are on an annual basis, and we're really looking at moving from a society to longer terms. So for those agreements to say, okay, maybe we need to look at this more as not as a year-to-year strategy, but as a 3 to 5 year strategy. So those are things that the C-suite and HR people need to start looking at more seriously. And then also, looking at your claims data to help be the landmark on where you have been to what problems you want to tackle first. Because people get healthcare fatigue because it becomes overwhelming, right? Like, how do I do all of that? So just tackle one thing. So if musculoskeletal diseases is your top line item in your claims analysis, well, then maybe you need to start at the workplace and do ergonomic testing or fit for duty, or making sure that you have a stretching program, or bringing in massage, or bringing in a physical therapist. Really customizing what your needs are based on past experience to predict future badness, if you will. And I think that we are in our infancy as businesses in being able to tackle that because it's overwhelming. And, most people's businesses aren't healthcare, right? It's something else. But we offer healthcare as a benefit. I would argue that that needs to be part of the strategy.
So for someone who wanted to get started building out a health and wellness strategy for their company, like, where would you recommend starting? What does that look like? What's that process like? If I've never done anything like that before, how do I get started?
So a couple of ways. So most employer groups use a health broker. So that's a really easy first step. States, through their health departments, have lots of resources. Worksite wellness programs for employer groups are another really good resource. And then just polling your employees, right? Maybe your company doesn't really want a Fitbit program. Maybe they want massages. Maybe they want, gym reimbursement. So really sort of looking at the needs of your company also is another really important place to start to get a needs assessment as to what is the biggest bang for your buck, because you can't do everything. And so strategizing on what's a priority is really, really important.
Great. Thank you. Do you have any specific examples of what you've seen other companies do as far as the strategic plan that have directly reduced their healthcare costs? Do you have just like an example or two of something you've seen one of your clients implement that's really made a difference?
So yes. So one of our larger clients has implemented both a worksite clinic, but also put in a robust wellness program that was run through the clinic. They added an on-site nutritionist that worked with the cafeteria staff to create the spa menu, put in community gardens on their campus. So now they are growing the food. The nutritionist is helping create menus for the food. The clinic is helping managing sort of from a sort of portion control size, and the cafeteria is serving that same food. That's magical, right? No, not everyone can do that, But that's really powerful to be able to see where your food is grown, to be able to harvest that food, to have recipes to make good food at home, and then to understand what portion sizes are to relate to all of that. I mean, that is unbelievable. And that company has seen, millions of dollars years over year in terms of that coordinated, integrated effort with the clinic at the base, aligned providers, and a support team that really embraces health and wellness.
Yeah, that's interesting because that's actually the second time I've heard of a company doing a corporate garden. And I think that example is just like this ecosystem that they've built, where it's going from ground to table to plate and to the employees. I think that is really, really interesting that I've seen that come up a couple times here in the last few weeks.
And it's a heavy manufacturing company. And so these people, otherwise employees, are lower wage earners. Some of them English is a second language. And there's lots of barriers to health. And so to be able to get organic good food for free, from just spending some time in terms of literally some sweat equity out in that garden to pull some weeds is huge, right? It's transformative. And the other sort of community good is that there's this huge ripple effect, right? Because if you're the one bringing home the food and you're preparing the food, then guess what? Kids and other family members, extended family members, they see this and they start to model this. And so the good is multiplied, if you will, as a result of it. And it's fantastic. And that's a really simple thing to do as a healthcare strategy, right? Is put in, if you have ample parking, tear up maybe a little bit of your of the hard top and put in some gardens. Those raised boxes, they're not that costly, but it makes a huge difference.
Definitely. What would you say some of the biggest mistakes you've seen that companies' employees have made when they've set up their healthcare programs? What are the pitfalls that our listeners should avoid if they're trying to build a healthcare strategy and they're trying to kind of break into this higher level of offering healthcare?
I think the biggest hurdle or maybe sort of barrier of sort of epic fail is it's having people not understand the why behind the strategy. If you don't get buy-in from your people as to why you're doing a certain strategy, it's never going to take off, right? And sometimes the why isn't easy to hear, right? The reason why we're raising the cost of your healthcare is because, we've had a 38% increase in our insurance premiums. And we've vetted all these other strategies, but this is what we're doing and why we're doing it and why we need your partnership to make this better. So I think that open communication is really critical. And I think we really undervalue that level of relationship and partnership with our employees, to be fair. I think as the C-suite, you have to model good behavior, right? Not do as I say, not as I do. And so having standing desks, I have a walking treadmill desk in my office and have standing desks throughout the company because it's important to me to model that and to kind of walk the walk, if you will. So I think that those are two important aspects on sort of those epic fails.
So you mentioned that you have some standing desks and you have a treadmill desk in your own office. Do you have some examples of some things you've done in your own organization to improve wellness and to improve the health of your own employees?
Absolutely. So we're still a small company, and I do have, I say, employer envy of other larger companies that get to do more. But within our small infrastructure, we've started this health and wellness journey. So last year we started reimbursing for anything related to fitness. So I didn't really care what you did, just do something, whether you bought a fitness ball or whether or not you went to a gym or whether or not you enrolled in a race. I wanted to make sure that if you did that you got some money back for doing that. So that was the 1.0 version for us. The 2.0 version this year, in addition to having the standing desks, and we have balls that people sit on for stability to help with their core, that we bought wearable technology. So we subsidized having anyone in our company that wanted to buy a Fitbit. We subsidized that. And next week, we are rolling out our first gamification challenge using those Fitbits. that as a team building exercise to help us from our corporate culture, right? Because corporate culture and wellness are really interrelated. To have some friendly competitions to again start engaging at a higher level of health.
That's fantastic. And I appreciate hearing the examples of like the really big companies because like our clients are a lot of the larger businesses as well. But for my own personal business, hearing some examples from what you guys have done where we're kind of similarly sized really gives me some things personally that I can try out with our own people.
Yeah, I think that we always hear about the big companies and being what they do. And you feel a little demoralized, or maybe it's just me that feels demoralized to say, well, I'm a small employer. How do I compete with that? But I think that you choose what the values for your company are from health and wellness, and you just start. And I think that that's really important. We are going through open enrollment right now for our health plan. And I had a little video webinar and I said, it's really important to me that you guys all get your preventive health services this year. And I got my age appropriate, screening done. And I really want you all to do that too. So messaging that and walking that walk, I think is also important too.
Yeah, and that's a theme we've actually seen with a lot of our clients too. And we did a series of video interviews last year, and every single one of the companies that we interviewed said that their corporate wellness, it all came from the top down, and it was all that buy-in had to come from the C-level people, and they had to set that example. So I think that's a really key piece that we need to make this successful.
Absolutely.
So what would you say companies could do to better integrate and connect their healthcare with their wellness initiatives? How do we marry those two a little bit better?
So it's interesting, and I spent some time thinking about this because healthcare is really siloed, right? And wellness is siloed. And we need to bridge those from a technology standpoint, right? To have one repository for all that information. I think that until we get to that point where we're sharing data better as healthcare providers and wellness vendors, that I think the ownership sadly needs to be on that patient to say, you know what, I'm going to take in my health risk assessment to my provider during my annual exam. And I'm going to go over it with my provider so that they know what I've done. And that way we can create a health action plan for me. And I think that that's how you start. I think if you have the ability as a company to integrate those two platforms, and we have that ability with us to do that, it creates a much more robust platform because now you're taking risk and you're marrying it with action, and you can really change behavior in a much more robust fashion. And so in the absence of being able to do that in a coordinated fashion, I think that employees need to be their own best health advocate, and they need to take that data to their provider because they're the ones that will be able to manage those parameters really at a one-to-one level with their patients.
So how do you think employers can get their employees to get that data and give it to their health care practitioners?
Well, there's lots of different ways to advertise that. So you can do, health fairs with biometric testing, creating it in a electronic format so it can be transferred in a HIPAA protected way to providers, which is still a challenge. I think another way to do that is to just advertise that you need to get your annual exam, that we do all of the biometric testing is really included in that annual preventive exam. It's covered by the ACA. It's actually free that employers are already paying for. But sadly, only 18% of all insured patients in the commercial market leverage that preventive visit. Wow. 18%. It's staggering how small that number is when it's a completely covered benefit. And so if nothing else, teaching our employees how and what their plan covers, and how to navigate that system to get those preventive services, we'll bend the curve just by doing that.
Fantastic. That's great advice. What would you say some of the positive effects that you've seen that come about when the wellness and the healthcare are really integrated in an organization? So when you see the healthcare side and you see the wellness side, and they're really doing a good job of sharing that information across the multiple areas of the business, what are some of the positive effects you've seen?
Oh, it's magical when that happens. So several things. Number one, employee engagement goes up. Productivity goes up. So we see the profit margin of those employers go up dramatically as a result. Retention improves, right? Turnover decreases. It's a great recruitment tool for employers to bring that on. And then lastly, which is, from the CFO level, the best is you start to see the cost of claims stabilize and then ultimately bend downward. So this coordinated effort actually works, and it works on multiple fronts. Some of it is hard dollar savings, right, from a claims savings standpoint. Some of it is just increased productivity, which, to be fair, is a hard number to measure, but you see it on the output on the spreadsheet, at the end of the year in terms of net revenues. But you also see this idea of corporate culture then cultivating in a way that is engagement at a whole nother level. So it works, it's effective, it's magical, and those employer groups that do this really are dumbfounded as to why they didn't do it sooner. They're like, why didn't we do this a decade ago? Like, I don't know.
So you said that it takes a little while for the cost to plateau and then it begin to bend down. What is kind of the average window you've seen? How long does that usually take?
Typically between 12 to 18 months, to be fair. Again, it's a new thing. It's a little creepy to go to your workplace to go get your health care, right? I'll totally own that. And it's a little creepy sometimes to engage in wellness at your workplace, right? It's a personal thing. It's loaded emotionally. So it takes a little while to have that uptake. And I totally own that. But as you do that, your early adopters are your best advocates. And then sort of this tide of patients will sort of transform and become bigger advocates. And then it becomes this self-fulfilling prophecy of, oh my gosh, I would never go anyplace else because it's so great.
Definitely. So how do you think companies can prepare for the future with healthcare and wellness and culture and all three of those together? What would just be like two pieces of advice that you would give anybody that's listening on what they can do to be prepared for what's coming?
I think, I'll go back to this, is I really think that employers need a healthcare strategy. I really do. I think that they need to sit down and have a brainstorming strategic planning meeting to really say, okay, where are we going as a company with our healthcare corporate culture? I think that is the first and foremost. Everything follows from there. I think the second thing is that we need to, as employers, start thinking more out of the box in terms of what other solutions that are out there rather than just the traditional sort of healthcare model, because we are in this really dynamic time of healthcare transformation that allows us as employers to really say, I'm still doing the same thing over and over again, which is the definition of insanity because nothing's changing. So how do I think outside the box? And as scary as that is to get out of your comfort zone, I think it's that out of the box thinking that really is how people then get to that next level of engagement, whether it be wellness, whether it be an on-site clinic, or whether it be other aspects of kind of that holistic approach to patient care.
I love that. And I love that healthcare strategy piece. That's something I've never heard before. And I think that is a really great idea. And I want to get started on ours.
Good. Let me know if I can help.
Okay, definitely. All right. Well, that is what we have for today. So thank you, Donna, so much for joining us. And thanks for sharing all of your wisdom and experience. We are really excited for all of this information.
Thank you so much for your time. I really appreciate it. I appreciate the partnership. Thanks.